Welcome back to Festival Italiano di Gianni Lombardi, and you just saw a really fresh, brand new campaign snippet of UHN's campaign called United, and it's my pleasure to welcome the CEO of UHN Foundation, somebody I work with as well, and I'm a proud board member. It's Julie Quenneville. Welcome to our show, Julie.
Thank you so much for the invitation.
So, Julie, UHN is such a big, there's 3 letters, but there's a lot to it. So let's start off with which hospitals make up this great organization?
So UHN stands for University Health Network, and it includes, it's an incredibly large organization located right now on 9 different sites. So we have the Toronto Western Hospital, the Toronto General Hospital, Princess Margaret Hospital. We have Toronto Rehab, which has 5 sites. And we also have the Michener Institute, Grace, which is really, really unique. It is the only educational institute that is part of a hospital. And why do we need that? Because we need to be training our healthcare professionals. And there are a number of shortages in different professions across the country. It's a problem that every hospital has. And so UHN, in merging with the Michener Institute, is really taking control and is creating more opportunities for people to train in those areas that we have national shortages. There are 12 health professions that Michener Institute, UHN, is the only place in the country where they can train in English. So it's extremely exciting opportunity for us.
Well, given what you just said, because my next question was going to be, why is UHN Canada's #1 hospital? So you just gave me a snippet. Why else is it?
It's actually also the #1 publicly funded hospital in the world. And it's not UHN saying that. Those are peer reviews. And what are they looking at, Grace? They're looking at a number of things. They're looking at publications, which means discoveries. They are looking, we have about 5,000 discoveries each and every year at UHN. The #2 spot in the country has less than 2,500 a year. So there's a very big gap between the #1 spot and the #2 spot. UHN does about $500 million each and every year in terms of research grants. So these are academic competitive grants that UHN has been able to secure. They're looking at the quality of the patient care. We're also the #1 smart hospital, and that is quite an achievement for a publicly funded institution.
And you know what, Julie? All of that, and now UHN Foundation launched a campaign called United that I think is going to highlight a lot of the things you just said. So I can say that it was a lengthy process to get to this campaign. It was really well thought out. A lot of people were involved, from staff to patients, and trying to get a message out that they felt was the right message about UHN. So start by telling us, what's the meaning behind this campaign called United?
And it's to share the message that when UHN comes together, seeing that everything is possible, it is. And our major tagline is "Never been done is what we do." And there are countless examples of world firsts, of major global discoveries that have happened right here in our city at UHN. And so it is a wonderful message. And it's also to share the excitement that we have and to build a sense of pride in this great Canadian institution, and to show that in a publicly funded healthcare model, we can innovate and we can make a difference, and we can make a difference globally as well.
And so what would the goal of this campaign be, Julie?
The goal is to, for one, raise awareness, build pride in this wonderful institution, but it's also to raise dollars. And it's extremely important. We are hoping that this campaign will inspire Canadians to support UHN and to help us to really continue to innovate. And if you think about it, we have more than 1 million patients coming through the doors of UHN each and every year, and each one of them have loved ones. If all of our patients and their loved ones gave even just $1,000 a year or even $100 a year, we really then are pooling our efforts together to make a difference. Philanthropy, Grace, and I know you know this very well from your volunteering and your leadership role at the foundation, but philanthropy makes the difference between quality and excellence. It is the most important source of revenue for innovation, And without philanthropy, we would never be Canada's #1 hospital. We would never be the world's #1 publicly funded hospital. So I take this opportunity to thank everyone who has contributed and have helped us to reach this great point, and hoping that we'll inspire others to join us.
You know, Julie, I'm very, privileged to be in these meetings and see firsthand and hear the research that's being done by these doctors, by everybody who works even at the foundation. It inspires me, and in working with you too, great leadership in getting this message out, because it is important. And like you said, you know, there's no set amount that needs to be donated. Whatever you can makes a difference. And I think that's the message that this campaign is saying, is one is, you know, letting people know the great work, but also every little bit helps, and we all can do it in different ways. But where can people go to find out more information about not just the campaign, but UHN in general?
Yeah, UHNFoundation.ca. You will find absolutely all the information we've shared today. And please do consider joining this incredible national movement. This is an important investment. When our loved ones are sick, we want to make sure that they have access to the very best care possible. And the only way we can achieve that is if we invest in innovation together.
And you know what, Julie? Together with Chin Radio, we are actually launching a radio campaign across the board in so many languages to get people, make people aware of the good work of UHN and how they can help. So people can tune into the radio station. And then we're also going to be running some spots here on TV. And I'm definitely going to invite you back for an update, and even in the future to talk about more about what the UHN Foundation does and what you do as well. So Julie, thank you again for taking time out today. And if there's any other last message you'd like to say, please go ahead.
Well, the message of thanks to you for your support and your leadership, and to our listeners as well for listening and considering and hopefully visiting the UHNFoundation.ca website.
Thank you, Julie. Buona domenica, si dice in italiano. Have a great Sunday. So, allora, that is, I love this UHN Foundation. You know, they're transforming healthcare, and together, like Chin is helping out, I'm helping out, Julie's helping out, we all can help out. So please check out that website and listen to our radio programs this week, not this week, this whole month, so that you can click on or listen to the messages from UHN. E adesso andiamo alla pubblicità.